Hi, welcome back. This video is going to go over anatomy of the upper limb. Right now we are looking at the left hand in anatomical position, meaning that we are looking at the hand from the palmar side. That way we can identify what structures are more lateral and what structures are more medial. So remember, the more medial structures are the structures that are closer to the midline of the body, which would be over here near the thigh. All right, so, and then also we talked about knowing proximal from distal. So proximal would be, so we're going to start with well, I guess we should start with the fingers, the most distal part here, right? The phalanges. So distally would be, on the upper limb, thinking distal and proximal. Distal would be closer to the tips of the fingers, and proximal would be closest to the shoulder joint. So as we're working our way up the arm towards the shoulder joint, we're working our way more proximally. As we're working down towards the fingertips, we're working our way out more distally. So we could say that the phalanges are the most distal part of our upper limb, anatomically speaking. All right, so let's look at the phalanges. Let's start with the first digit. It's a little bit different because the first digit only has two phalanx, right? So it has a distal phalanx and a proximal phalanx. And then the joint between the distal phalanx and the proximal phalanx is called the interphalangeal joint. Then we have the metacarpal working our way more proximally. And then articulating with the thumb here, that first digit, the metacarpal of the first digit, we have the trapezium carpal bone, which is part of the distal row of the carpal bones. And it's the most lateral of the distal carpals. All right, so then let's look at our second digit. Here we have three phalanx, right? So the digits 2 through 5 have three different phalanges. So we have a distal phalange, phalanx or phalange, a middle phalanx, and then a proximal phalanx. Therefore, we have two different joints happening here between the phalanges. So we have a distal interphalangeal joint between the distal phalange and the middle phalange. So distal interphalangeal joint, right? And then we have what's called the proximal interphalangeal joint between the middle phalange and the proximal phalange. So the proximal interphalangeal joint. And then where the proximal phalanx, where the proximal phalanx, let me jump to the third here, where the proximal phalanx articulates with the metacarpal, that's called the metacarpophalangeal joint. So we'll be using the metacarpophalangeal joints for our central ray placements on our a lot of our hand images. All right, so now that's the phalanges, right? Then we have the metacarpals here. And then the joint between the carpals and the metacarpals is called the carpometacarpal joints. Carpometacarpal joints, CMC joints. All right. Can't forget the little sesamoid bones. We have these little sesamoid bones here on the first digit. And we'll be doing imaging, specific imaging of the sesamoids on the foot, not really specific imaging of the sesamoids on the hand. All right, so distal row of the carpals, working our way from the lateral side, which would be our thumb side. Our radial side is our lateral side of our arm. So we have the trapezium, the trapezoid, the capitate, the hamate. And then bringing ourselves back over to lateral, looking at the proximal row of carpals, we have the scaphoid, the lunate, the triquetrum, and the pisiform. All right, and this, once again, this is looking at the hand in anatomical position from the palmar side. I'm going to attempt to rotate this hand around and bring it down so that we're looking at it the way we would look at it on an actual x-ray. So just playing around here with this. Let's go to the other hand since I messed that one up. So here, let me rotate him just a smidge around. All right, so this is how we'll actually be looking at our hand x-rays. This is how we take the x-ray of the hand. We'll be looking at it with the digits pointing upward, and the hand will be palm side down on the IR. So we'll actually look at our hand x-rays just like that. So we'll be looking at the back of the hand on our x-rays. So we have to remember that the thumb side of the hand is the lateral side of the hand anatomically. So that's how we will be identifying these different structures on the hand. All right, anything closer to the thumb side will be more lateral. All right, so so looking at the carpals the way that we would in a hand or a wrist X-ray, because in the wrist X-rays we also will have the hand palm side down on the IR. It will be a PA projection. We will hang the wrist x-rays with the digits pointing upward. All right, so it's just the way that we take and view our hand images. So we have to keep in mind the thumb side is the lateral side. So, but the proximal and distal stays the same though, right? Because proximal and distal is just you know, projecting away from the point of origin where the arm attaches to the body at the shoulder joint. So we'll still talk about the proximal and distal row the exact same way. Closer to the radius and ulna is the proximal row. Closest to the metacarpals and the phalanges is the distal row of carpals. All right. So this is how we'll be identifying the carpals on our X-rays. So when you do when you comp your X-rays out there in clinicals and they come in to audit with you, they're going to be pointing at different carpals and asking you, what carpal is this? What row of carpals is this? Is this the distal row? Is this the proximal row? Is this the medial or the lateral? You know, so so keeping in mind, thumb, lateral side. So we'll start with the trapezium, the trapezoid, the capitate, the hamate, then come back over here to scaphoid, the lunate, and then the triquetrum and the pisiform is on the palmar side. All right, so those will be superimposed. So the carpals look good, you know, on the carpal images, depending on what image we're looking at, they'll start to superimpose each other. You know, there's a lot of overlap there on those carpals. So if I take this hand and I start to rotate it into more of an oblique position, you see how the carpals will superimpose each other on our x-rays. Another thing, look at what happens here at the metacarpals and the phalanges, right? We'll start talking about over rotation of an oblique x-ray would superimpose these metacarpals, right? So, you know, so we're going to be talking about that in a lot of detail about identifying over rotation or under rotation of these hand x-rays by looking at the superimposition or separation of these metacarpals and the phalanges. Another thing we'll be talking about with the x-rays of the hand is it's important that the part, we'll be talking about this with all of the extremities, is that it's so important to keep the extremity or the part of interest parallel to the IR. So in this case, I don't have the hand. The hand really isn't parallel. It's a little bit, the joints are a little bit bent. They put it like a natural bend in these joints for the picture and a more natural, you know, state instead of the fingers being stretched out. But we're going to be asking our patients to stretch out their hands, stretch out those fingers, straighten out those joints, and place the hand, phalanges, whatever it is we're x-raying, parallel to the IR, right on the IR. So we'll be looking to see open joint spaces. So you see how these joint spaces are starting to be open between these two phalanges. So, so if we take this as we take the hand and kind of tilt it into more of an angled, you know, if we angle the hand, you see how those joints close. As I bring the hand so that it's more parallel, Now we can see those joints starting to open and being more clearly demonstrated. All right, so we tilt it, joints close up, and we don't see open joint spaces in our image. You can really see it happening here at the metacarpals, actually, between the metacarpal and this proximal phalanx. So let's look at that. Let's kind of like focus there and see what happens as we bring it back. You see now we can see the joints open. I'm just having to kind of tilt the hand back so that it's more parallel. And then we can see those open joint spaces, all right? Okay, so that's something that's a big thing in X-ray, making sure that the part is parallel to the IR, that the part of interest is as close to the IR as we can possibly get it to decrease the OID, which will increase the detail of that bone on our image. Let me flip this guy around. Flip this dude around, bring him back. Let's look at the forearm. Let me bring him up. Get this guy in center. All right, bring this arm in center here. Look at the forearm, all right? So we looked at the hand, we looked at the phalanges, we looked at the carpals. Let's look at the radius and the ulna. Remember, just embed this in your brain. The radius is on the lateral side of the arm. The ulna is on the medial side of the arm. You've got to know that. That's going to help you a lot when we start talking about our projections, okay? Our forearm, our lateral forearm, will be doing it as a lateral medial projection. So, it's important to know, are we going through the thumb side, or is our X-ray entering the thumb side or the ulnar side? Because that will change the way that we name the projection, where it enters and exits the arm. All right, so on the radius, we're going to be, we'll be identifying structures like the styloid process of the radius, which is the most distal part of the radius, and the styloid process, this little point here on the ulna, once again, the most distal part of the ulna. The ulnar head is down here distally. The radial head is up here proximally, all right? And then we have the radial notch where the radius articulates with the ulna. So the radial notch is actually on the ulna itself, all right? And then the ulnar notch is down here. I'm so sorry. The ulnar notch is on the radius itself, where the ulna articulates with the radius, all right? So these notches and fossas are named by not the bone that they're on, but they're named by the bone that articulates at that notch or fossa, all right? So when we say ulnar notch, that ulnar notch actually is a part of the radial bone where the ulna articulates with the radial bone. When we say radial notch, that's part of the ulnar bone where the radius articulates with the ulna. I just want to make sure that you understand that. And I think that that is a little bit more clear here at the humerus, the distal humerus here, where the radial head, when we bend our elbow, when we bend the elbow, that there's got to be a place for this radial head to go. So if the radial head fits in the radial fossa of the humerus. And then we have this part of the ulna that's called the coronoid process. They don't have it labeled here, but that little where it's coming out to a point right here, this is called the coronoid process of the ulna. When we bend our elbow, that coronoid needs a place to go. So there's a fossa here, again, at the distal humerus called the coronoid fossa. So we have the radial fossa, part of the humerus, but where the radius articulates with the humerus. The coronoid fossa, part of the humerus, but where the coronoid process articulates with the humerus, all right? We are going to be talking in depth when we get into the elbow x-rays and our forearm x-rays. We'll be talking about these condyles on the humerus. The distal humerus has condyles and epicondyles. Epi just means above the condyle, right? So we have the condyles of the humerus. We have a medial condyle closer to the body, a lateral condyle, once again on the radial side, lateral condyle. So we talk about lateral condyle, medial condyle, lateral epicondyle, medial epicondyle. All right, so we'll be talking about those on our x-rays describing sufficient rotation, insufficient rotation, is it in profile, is it not in profile, those type of things, all right? So that's going to become very important to us when we're looking at this anatomy on the x-rays. Now, let me turn this arm around so that we can see the back of the arm. Let me pan this over, get him where we want him. All right. Okay, so this big structure here, look, this is the medial side of the arm, right? Because it's closer to the body. So this has to be the ulna, and this is the radius. And we can identify the radius. We can see the radial head very clearly here, right? Right, get the little radial tuberosity sticking out here. It's going to articulate with the ulna at the radial notch. All right, so this big knob right here is what we've always called our elbow, right? So this is the olecranon process, olecranon process. Now, the olecranon process needs a place to go when our arm extends. So we have, let me see if I can rotate this around. Uh-oh, my bad. Let me see if I can rotate him around, get in there. Yeah, see, so here, let me tilt him up a little bit. Let me see if I can tilt him up. You see this area right here, this shaded area here, all right? That is the radial, I mean, not the olecranon fossa, right here, where the olecranon will fit in to the humerus. So once again, olecranon fossa, part of the humerus, but where the olecranon articulates with the humerus, all right? So they name them by the bone that's going to be articulating there. So kind of turn it around and so you can see that fossa, that big deep fossa there that's there for the olecranon, all right? You can see those condyles, the medial condyle, lateral condyle. Let's flip this back around. I know I'm flipping and flopping here, but I keep thinking of things as I start talking about one thing, then it reminds me of something else. So we looked at we've been looking here at this proximal humerus. So I talked about the condyles, right? We have a medial condyle and a lateral condyle, but this structure here, right, is called the capitulum or capitellum. They even spell it differently and depends on what literature, wherever you find it. Some places they call it capitellum, and it's spelled differently than if they call it capitulum. And I think our books spells it capitulum, capitulum. So that's how I learned it, and that's how I usually say it. All right, but you may see it capitellum, capitellum. I've seen that as well. Anyway, so we need to know that the capitulum is superior to the radial head, right? So put these structures in perspective as to where they are in reference to one another. It's going to help you a lot by when you have to identify these structures in your x-rays, okay? Now, we have what's called the trochlea. There's another round structure here on the distal humerus called the trochlea. Notice the trochlea is more medial. The trochlea articulates with the ulna. So if I rotate let me see if I can rotate this ulna out, the arm out a little bit. Oops. Let's see, rotate it this way. Oh, the body's kind of getting in the way, but at least we can see through it. All right, so here, where the ulna is articulating with the distal humerus here, that is called the trochlea. So the trochlea allows for that hinge motion in our elbow, right? I'm gonna do something crazy and flip it around again. Sorry, guys. It's Saturday. It's Saturday. Let's get a little crazy here. All right, so okay, here we go. All right, so now let's see. What was I talking about? Oh, I was talking about the trochlea, right? Let me rotate this out. There we go. Okay, you see how the ulna wraps around that distal humerus there? That's occurring right around the trochlea. So that, the ulna, the proximal ulna is shaped kind of like a wrench. if you think like a wrench, and it wraps around the trochlea on the humerus. See there? Right here. We call it the notch right here, the trochlear notch of the ulna, because it's the notch that surrounds the trochlea. So we call it the trochlear notch of the ulna. Um, so just wanted you to understand that relationship there of the ulna wrapping around the trochlea, and that's where that hinge motion of our elbow happens. All right, so this was just a nice little overview of some things that we're definitely going to be discussing in lecture. So I'm hoping that this is helpful, kind of help you to put some things into perspective as you're studying at home and looking at these x-rays. Um, and really just remember, you have 3D apps that you can, this is Biodigital Human. It's wonderful. I keep telling you that over and over again. Make sure that you have a 3D app that you can play around with and really take these structures and start, rotating them into those obliques and see what's happening there with these bones and these different bony landmarks things as we rotate into these different positions. So I hope that this was helpful. Have a great day. Thanks for watching.